And this week it was reported that the Ohio Department of Health doesn't know where all those deaths happened. It said in a court filing in response to a complaint from the Cincinnati Enquirer that it can't search the COVID case database for deaths in long-term care facilities because it doesn't maintain records from them. Previously, the state had said it would not release those deaths by facility to protect privacy rights. The toll of this pandemic is obvious on residents, family, and staff of nursing homes, assisted living, or skilled care facilities. Statehouse correspondent Jo Ingles has more.
This year has been tough for the Hunter family of Stowe. Michele's mom, Donna Cook, has been in an assisted living facility there.
And we would go on Wednesdays and have cookie night with her, and then we would bring her to our house and on the weekends. And then in March, when everything started shutting down, it became very difficult. We couldn't see her first at all. And then when we could see her, it was trying to coordinate with window visits and the telephone. And so it's made it a lot more difficult and hard on all of us.
Michelle's daughter, Allie, says it's clear the pandemic has taken a toll on her grandma.
I could just tell it's hard for her because before we were able to see her and we were able to bring her over and she could spend time with us and eat and stuff like that. But now that she can't spend any time with us, she has no one to spend time with. She used to have a roommate, but her roommate passed away and she hasn't gotten a roommate since. So it's pretty lonely for her. You could just tell when you go over to see her, she is depressed sometimes.
She's not alone. Pam Fry's father, Stephen Miller, is in a memory care unit in Stowe, and her mom, Virginia Miller, is in assisted living.
We have not seen my dad since March. We've done a few outside visits, but every time the state goes to a orange, they stop all visits altogether. We can't even right now do window visits. We're not permitted to take food to my mom. All we can do is take her things that they can wash down with, sanitizing wipes. We couldn't take her Thanksgiving dinner. She couldn't come out for Thanksgiving. We couldn't visit through the window. My dad, what's really hard with my dad is, he has Alzheimer's, so he doesn't understand a Zoom meeting or a video call on a phone, or he doesn't understand it, so he gets very frustrated. And it's sad because we don't know when we can see him again.
The upcoming holidays make the situation worse for many families. Don McCann's mom, Martis Fromm, is in a skilled nursing facility in Delaware. He says she's missed coming to his house for Thanksgiving and has questions about the Christmas tree the family usually sets up in a room.
Why am I not getting my Christmas tree put up? Why am I not getting my Christmas tree put up? And I got to keep explaining to her mom because we're not allowed in the facility right now. I said, you can ask. So she did ask Willowbrook, but they don't go that far to be digging people's decorations and all that kind of stuff out. They have decorated the facility, I think, but not necessarily. But mom likes to have her Christmas tree in her room. So that's been a toughie.
COVID has been tough on nursing home employees, too. It's been widespread among staff and residents in many facilities.
The staff are overworked, spread very, very thin. We also have, turned into an extended family for our residents. Their families aren't there daily to see them and spend time with them. And the people that they are used to sharing their daily lives with are no longer able to come in to see them any longer.
In a news conference with Governor Mike DeWine, Watkins explained the emotional stress COVID is taking on nursing home staff. She told a story about a nurse who came back from maternity leave and found half of the residents she had cared for had passed away.
And they didn't get discharged home. They didn't go to another room. They were gone. And the pain and the emotion that I saw in her face coming back to that when not being there during that time was devastating.
2/3 of Ohio's nursing homes belong to the Ohio Healthcare Association. Its director says families are being strongly discouraged from taking residents out of facilities for home visits, even during the holidays, because of the risk of COVID. But he says if the resident's emotional well-being is suffering due to a lack of visitation, families can ask for what's known as a compassionate care visit.
The idea of a compassionate care visit started out with end of life, and then it's kind of grown from there to include situations where a person is grieving, is depressed, is declining because of lack of contact with their social contact, or especially contact with family. So that can be, in my mind, that can be interpreted fairly broadly, and we're suggesting to members, be liberal in these days, the holiday period, about that. We think they should be fairly liberal about compassionate care visits in general, given the circumstances that regular visitation is shut down, but especially around the holidays.
Family members making compassionate care visits will be required to suit up in PPE, and these visits are not a substitute for regular visits. But as medical experts have said, the bottom line is the well-being of nursing home residents relies on the behavior of communities where those facilities are, because that's how the virus gets inside them.
I know my mom on Wednesday night last week called me just sobbing, and she was watching the news, and she's watching, all these people who have been warned, don't travel, don't do this, don't. And she goes, do they not understand there are people like me that just want this to go away and be, even if it doesn't go away, just make it so it's yellow so we can see you again, in a window or something.
I think the big key to all of this is just being somewhat responsible. You have to be responsible, and I mean with everybody. I don't care, whether you like wearing the mask or don't like wearing the mask, or, we're all in the same boat.
It's a small price to pay to wear a mask and social distance. I feel that if we were more vigilant about this earlier in the year, we wouldn't be where we are now. Again, what gets me the most is the elderly generation, the people in nursing homes. They've worked their entire lives to have this time to spend with family, to spend with the grandkids, and now they're being robbed of this. I think a lot of that is to do with people being selfish and just not following basic guidelines that could help us all.
Jo Ingles, Statehouse News Bureau.